let you guys know there's very, very common complaint coming through the clinic lately of people with pain running down the arm. And a lot of people will assume that if there's pain going down your arm, it's going to be a pinched nerve. And that's often that I've found not the case. And really, when you look at the things that can cause pain down the arm, a pinched nerve isn't the only thing. And very, very commonly, we will see that trigger points will cause pain down the arm. And today I want to talk about trigger points in your rotator cuff, in your shoulder blade that can cause pain down your arm. And they're called your external rotators, or infraspinatus and teres minor, which often will feel very major. And they're two of the four rotator cuff muscles. Very, very commonly, when we have some sort of instability around the shoulder or in the neck, the shoulder blade muscles, the rotator cuff muscles, will kick into overdrive to help supplement whatever stability is not present. That being said, they overwork, they change blood flow to them, and you can develop trigger points, which are hyper irritable points of kind of bound up muscle and that are usually very painful. And an active trigger point is what we call that active kind of bound up piece of muscle that refers familiar pain. And I'll get folks with pain all the way down their arm into their hand, and they're sure either they have carpal tunnel or they have some sort of pinched nerve. And when we do our assessment, we'll crank the neck kind of in different positions and see that it's not the neck referring pain. We cannot reproduce pain within neck testing. And as I get into my palpation, as I'm working through kind of feeling these muscles, I'll hit these hot spots in the shoulder, and yep, it'll refer right down the arm into the hand. So if you're feeling this, I want to encourage you, get to your physical therapist, get it checked out, because it's really easy to manage. Here at Chandler Physical Therapy, we use soft tissue work, we'll use joint mobilizations, we'll use dry needling and Graston therapy to kind of get the tissue moving to improve blood flow. And then from an exercise standpoint, we're going to jump into some light shoulder stability to promote better positioning and use and balance of all those muscles around the shoulder and neck. Now, if you have questions and you're worried maybe, hey, it is related to my neck or something like that, obviously talk to your doctor, talk to your physical therapist. And if you are interested in learning more, you can jump in. There should be a link somewhere in the description of this video for a discovery visit from Chandler Physical Therapy. And what that is a one-on-one visit with me or another physical therapist. We sit down and we kind of go through all your symptoms, what's going on, when it started, all sorts of background information. And then we'll do a full-blown exam to say, okay, yes, this is what I think is going on, or hey, I think this is going on, to decide whether, A, physical therapy is appropriate for you, or do we need to go a different route, and which provider to go for. So if you're interested in that, check that out below. Hopefully, if you're feeling pain like what you see in this picture, let us know. It's often easy to manage using muscular trigger point work. So have a great day. We'll catch you on the next one.